Okay, welcome back to the Mid-Atlantic Virtual Summit. It is now time for our final session of the day, a fireside chat with KLAS Research. As a final reminder, I'll mention that if you would like to submit a question during this fireside chat, please do so by utilizing the chat function within the Zoom platform. With that said, I would love to once again re-welcome Mark Haglund, our editor-in-chief, back onto the virtual stage here to moderate this fireside chat. So Mark, take it away.
Thanks so much, Matt. And thanks to everyone for sticking around. We really appreciate it. So it's my great pleasure to welcome Doug Tolley from KLAS Research. And I am going to begin our session by asking Doug to tell you all about himself. So welcome, Doug. Why don't you share about your background and what you've been doing at KLAS, which has everything to do with why we're speaking. It's very exciting. So welcome, Doug.
Thanks, Mark. It's good to be here, everybody. My name is Doug Tolley. I'm the general manager of our business development unit here at KLAS Research. I've actually been at KLAS Research now close to 11 years, although I took about a 5-year sabbatical and went and worked in the telecom industry. And now I'm back with KLAS for a little over 3 years, getting close to 4 years. My team works on innovative, disruptive, and new technologies here at KLAS. And we're today talking a little bit about our emerging tech research that we've started doing over the last 2 years. But I also head up the group that advises private equity and venture capitalist firms on potential healthcare acquisitions. And we have a number of other business development pieces in the hopper right now, coming soon to a provider near you. So,
wonderful. Well, tell us about the Emerging Technology Division at KLAS. What inspired you and your colleagues to create it, and what is your core mission?
So, Mark, our mandate at KLAS is pretty simple. Everything we do has to benefit provider organizations. If we do work, it has to be with a single focus on how does this benefit provider organizations. So we have an advisory board made up of provider organizations. We're very heavily involved with Chime and AMDIS and other organizations. And over a couple-year period, they kept telling us, KLAS, you're amazing at differentiating between pop health vendor A and pop health vendor B, or EMR vendor A and EMR vendor B. But we as a decision maker, maybe a CIO, we get inundated weekly with so many new vendors that claim that they're the next biggest thing in healthcare, or they're going to solve these problems. And they kept saying, KLAS, is there anything you could do to help us cut through the noise, to really understand separating hype from reality or fact from fiction around these emerging tech vendors? And we took that feedback for about a year and didn't really know what to do with it. But after we got that feedback enough times, Mark, we said, hey, we've really got to do something about this. And so my team worked on and stood up a new emerging tech product at KLAS, where we go out and interview the first 5, 6, 8, 10, 12 customers on a brand new platform or a brand new software or a brand new service that's innovative, disruptive, maybe an emerging technology, and then report back to the market what we find on those early customers. It's not the same as a full KLAS rating or KLAS ranking, but at least it provides, again, to our provider friends, our primary constituents, some indication of whether this product is real, whether they're getting real outcomes, how many customers they actually have, how many customers are happy, and sort of where this product is headed. And that's what we've been working on. Our team's been working on for the last getting close now to 2 years. So
that's absolutely terrific, and there's definitely a need. I think it's really interesting, Doug. I'll just say how the structure of what you're doing matches what the need is, right? So with super established vendors in super established areas like EHR, you already know what you're,
right,
ranking. With emerging technologies, it's more important to identify and explain, and you guys are doing that, which is wonderful. So I understand that there are 8 areas that you've kind of been looking at. Can you share with us what those are?
So it's funny because as we started this, we didn't really have a preconceived notion of exactly where this would go. And so we just started publishing reports. In fact, one of our first reports we ever published was on a company called Patient Ping, which recently has been acquired and then went public. And boy, that's been a rocket ride for those guys. And then Olive AI was one of the like second or third one we ever published. And again, I think they're on Series G funding now, and they're in the news a lot. But as we started publishing these reports, and we've done since the beginning of the calendar year 2020, we've done now about 75 of these spotlight or first look reports, these single vendor reports to tell the market what we know. We started seeing that they grouped around themes. So it was funny because we did, one report on an emerging telehealth vendor, and then 5 or 6 more come out of the woodwork, and we end up getting a cluster around telehealth. We did a grouping around social determinants of health. We ended up with, not surprisingly, a whole group of reports around patient engagement and what's going on with that. Of course, COVID really drove a lot of consumerism where, maybe for the first time we've talked in healthcare about consumerism for more than a decade, but now suddenly having the patient at the center of this experience, especially during the pandemic, really brought that to the forefront. A couple other areas, robotic process automation, a group kind of coalesced around that. Digital documentation. During the pandemic, people didn't want scribes necessarily in the room. Another body in the room increases risk. And so digital scribes, virtual scribes, ways to capture notes from a clinician directly into the EHR became interesting, and a group clustered around that. And then things like physician workflow and artificial intelligence have started to grow a little bit too, but those are some of the main areas. And again, it was a hypothesis of ours that these reports would group around certain themes, and they certainly did. In fact, not surprisingly, those were the things that were on decision makers' minds. So,
Okay, great.
Yeah.
I would like to zero in a little bit on 2 areas, but first, what is it that people want to know? Meaning, obviously they want to know what these products do. That's obvious and basic. Are they looking to understand how real they are, how fully developed and evolved they are, how they integrate with other technologies? What elements are they most interested in?
Yeah, it's interesting you'd ask that because you're spot on. Those are really some of the key things that they do want to know. So let me outline a few that, and again, we took this feedback from our advisory board. We gave some early reports to provider friends, provider organizations, and said, okay, what's missing for you? What else do you need? And they helped us iterate very quickly. If you looked at our first report versus the ones today, it's evolved quite a bit. But here's the key things they want to know. Is the product real? Or is it just a slide deck? Is it vaporware, or is there something tangible? Number 2, provider organizations, healthcare organizations for the most part they don't want to be on the bleeding edge of anything usually. Yeah. So they want to know who else has used it, how many customers are there? Am I actually the alpha customer, or are there others that are actually using it? And what experiences are they getting? And then our advisory board came back and said, there's certain parameters that really matter to us in addition to those things. Number 1, tell us about the management. Often you bet on the jockey, not the horse, right? So have they been there and done that? Do the executives at these companies have a track record in healthcare? Is this their first time?
Right.
Is this coming from another industry? Robotic process automation, we're going to talk about, Mark, but robotic process automation is interesting because it's been around in manufacturing for a decade, but now it's finally coming back or coming over into healthcare. So, are they healthcare specific? Are they from cross industry? And then they wanted to know how hard it was to put this thing in. If you buy a new piece of technology and it's really hard to implement, then who cares about all these amazing benefits? If it's really a pain to implement, then that's interesting. And then the last one I'll mention to you is they really coached us on how fast do I see outcomes? Is this a 6-month runway? Is this a 1-year runway? Is this a 3-year runway? And triangulating time to outcomes plus how hard is it to implement was an interesting kind of way for us to sort of display this data. So we get outcomes quickly, and it was relatively easy to put in. Those kind of become home runs. Hey, it's kind of hard to put in, and the outcomes come in 18 months. those aren't as attractive to, to decision makers. And so those were some of the key points they ask us to measure. And of course, lucky for us, a lot of those questions are part of the core KLAS methodology and question set anyway. But those were some of the keys. How hard is it to put in? How quickly to get outcomes? Tell us about the management. And then, is this their first time in healthcare, or are they kind of healthcare veterans? Those were some of the key decisions in the decision makers. So
terrific, Doug. Yeah, I mean, I have to, when you were speaking just now, it kind of took me back to my very first HIMSS conference, which was in 1991.
Wow.
Yeah, 4,000 people in San Antonio.
Oh, wow.
It was a different world. But what brought me back to was, at that time, there was a lot of vaporware. Yeah. And you would walk the floor, and the discussions were so interesting because you didn't really know. That was way before KLAS, right? So you didn't really know what worked, what was real. And there also, one big difference between then and now is there wasn't a clear policy, purchaser payer direction in healthcare. There is now. We know where we're going. We're going into population health, care management, reducing costs, right. All of these things. At the time, things were much more confused and open. So there was this weird, legitimate fear of vaporware. And related to that, also, many of those companies, I would say, of the companies that were exhibiting in 1991, probably 95% are gone now.
Yeah.
Right?
Yeah.
And so that was a huge element. So yeah, no, I think you're answering all the right questions and the ones people want to know the answers to. So,
and Mark, just a real quick point on that. So the tagline on this product is separating fact from fiction in emerging technologies. Yeah. So when people say, what does this thing do? We say, we're trying to separate fact from fiction for emerging technologies so that provider organizations can feel safer in their decision to try something. So.
Yeah, terrific. Yeah. Again, I'll just invoke HIMSS 1991.
Right.
I remember, and I've been in healthcare publishing for 32 years, but I had only been in the field a few years, and that was my first HIMSS. And I remember sitting with vendors, and they're saying things to me like, we can do blah, 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 blah. And I would walk away going, oh my God, am I stupid? Am I crazy? This person just said blah, 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 blah. And I literally didn't understand what they were talking about.
Right.
And then I realized I wasn't that stupid and I wasn't that crazy. That in fact, some of these descriptions were vapory, right? They were like, well, we can kind of wash dishes in space. And, it would be like, okay, so this is such a great service. So I really appreciate it. Sure, absolutely. So now let's talk about two specific areas. Let's talk about SDOH and then robotic process automation. SDOH, the need and the desire are incredible right now in healthcare. Everyone is talking about SDOH. They should be talking about it. It's where everything is going. So what did you find when you started exploring these companies?
Yeah, this has been a fun one. So we do a survey in our standard KLAS research methodology. We kind of have a question right at the end that we started asking a couple of years ago, which is kind of interesting, which says, are there any innovative or disruptive technologies your organization is planning on investing in the next 12 to 24 months? So talking to a hospital CIO, hey, anything you're looking at that's interesting or different? Sometimes they can answer that question, sometimes they can't. And then we follow it up with, are there any vendors that have kind of caught your eye? Is there anything kind of on the horizon or that is innovative or disruptive from a vendor perspective? Have you heard of a vendor you could maybe name a name that maybe KLAS should go look at? 2 years ago, the name NowPal was coming up. And it came up more frequently than some of the other names when we asked that question, can you name a vendor you've been taking a look at? So we said, well, this is a mandate from our provider friends. We've got to go find out who is NowPal. By the way, that sounds like a fake company. So is that real? Who are they? What do they do? Turns out NowPal stands for knowledge is power. That's how they got their name. So kind of a cool name. And we went out and we said, oh my gosh, they're in this new kind of world of social determinants of health, which is like population health 3.0. This idea that 90% of what happens to a patient happens outside of their doctor's office or outside of their acute care ED or acute care stay. And so they started, we figured out, okay, well, this stuff matters. Community-based organizations, faith-based organizations, mental health. Do you have enough food? Do you have food security problems? Do you have, adequate employment? Do you have a place to live? If you don't have all of those needs taken care of, taking your diabetic medication might be really low on the list if you don't have food or a place to live. And so NowPow was really interesting to us. Because of that research, we felt like providers had said, provider organizations had said, KLAS, you need to find out about NowPow and tell us what you know. Yeah. So we did some pick and shovel work, Mark. We went out and we found 10 or 12 customers without any help on our, press releases, searching the internet, asking around, getting referrals. And we interviewed their first 10 customers. And then we called NowPow and we said, hey, we've talked to 10 of your customers. What's your interest level in understanding what we know? And by the way, they knew who KLAS was from previous, relationships and other things. And they said, man, we've got to know, we've got to know.
Yeah.
That
who
evolved.
Doesn't want to know what their customers say about
Exactly right. So, and we kind of said to them, we're not trying to, we're going to publish a report on what we found. And they said, well, we'd love to be part of that and, be part of that research. We said, fantastic. From there, it evolved into kind of Aunt Bertha, Signify, Healthify, Unite Us, other social determinants vendors then came and said, well, if you're going to include them, you've got to talk to our customers. And before we knew it, we'd actually developed a new market segment at KLAS around social determinants of health platforms. So that's kind of how that evolved, but it really was a mandate from provider organizations. Social determinants matters. Go learn about this class, come back and tell us what you found. Now we're going to do a full ratings and rankings. It's going to be a best in class category moving forward. We've got a summit next spring on social determinants of health. This has really evolved all out of that research instrument, which was basically organizations telling us, KLAS, go figure this out and let us know. So.
Right. That's wonderful. Let me ask you, and I know this is going to feel incredibly superficial, but in a few-ish sentences, where do you see social determinants of health information technology solutions right now? What are they capable of, and what can we kind of bank on, and what's still to be worked out?
So it's interesting. The first step was, by the way, my wife's a social worker. So when I say this, I'm not insulting social workers. I'm very close to one. When you were a social worker at the hospital and found a need like food insecurity, typically what you do is you had a drawer full of pamphlets. Here's a couple of food banks. You'd give them a pamphlet and you'd hope that they took the proactive step of going and getting with the food bank and taking care of this really important problem, right? But it was kind of a give a pamphlet and hope for the best. That was what happened, a few years ago. What these platforms, again, like NowPow, Unify, Signify, Aunt Bertha, Unite Us have done is they've created what I would call a closed loop to these referrals. So it's an electronic referral that now resides in a database that can actually be followed up on. Yeah. And then, if the faith-based, community-based, whatever organizations are tied into the network, then they can see the referral. They can be more proactive about it. And then when it really gets powerful, Mark, is when that loop closes all the way back into the electronic medical record, so that the next time this individual lands in the ED, for example, then you can see that there was a referral to a food bank, there was a referral to a homeless shelter, there was a referral to a mental health organization, and you can actually follow up on that so that we start to treat the whole person instead of just that one symptom, diabetes, or that one symptom, heart condition, because all of those other factors are massive. In fact, again, if this was Maslow's hierarchy, those things are more important than the next disease state, because if you don't solve those, none of those other things are actually going to take place. So we're seeing these organizations build these great networks, closing the loop on referrals. Then as they feed into the EMR, then we're really seeing some power. And if those two things happen, then you can start to do analytics on this data and how many referrals were followed up on, and how does this affect my diabetic population? Or how does this affect, the mental health of this population? And then we can do some really cool things with data and aggregation analytics, but it had to be electronicized first. Then it has to feed into the clinician workflow through the EMR, and then the analytics tools layered on top of that. That's where this is headed. And I would say we're still in our infancy on this. This is really like a year or two in to actually seeing things really start to work. I'm excited to see where it goes over the next few years. But
it's very exciting. I mean, this is what people have been hoping for, because it's not that people were not concerned about SDOH, but like literally, where do you put the notes?
Right.
And then they just kind of sit in some weird ether that has nothing to do with anything in the world. So that's very exciting, Doug. Let's talk about
one other thing. Real
please.
Fast on that, Mark.
Yeah.
There's another category of SDOH, and I think I'd be remiss if I didn't mention it, but companies like Carrot Health and Algorex and Socially Determined are now building those analytical layers on top of those other vendor platforms. So we are seeing vendors now being able to do those analytics so that we can really, really start to solve those problems. And we think that's super exciting that there's now social determinants of health analytics vendors that are now feeding the ecosystem as well. So
I agree. Absolutely. Absolutely. So let's talk for a few minutes about robotic process automation.
You bet. So the story is very similar. Yeah. We heard a lot, and so did everybody. There was a lot of buzz about Olive. They'd received a lot of funding. They were making a lot of noise. In our research instrument, again, their name came up on a repeated basis. Like, we felt that we now have a mandate to go find out who is Olive and what are they doing. Got in touch with their leadership, had some really interesting conversations, and found out that they were a purpose-built, healthcare-specific robotic process automation vendor, and they were seeing some really good early results. And for people who don't know what robotic process automation, it's essentially taking some artificial intelligence, machine learning, a bot, if you will, that you can train or teach to do repetitive tasks that they do better than the humans anyway, and then you free up the people to operate at the highest level of their license. So I'm not sitting there grinding through claims all day. I let the computer grind through the claims, and then when it finds a difficult exception, then the person can go, go find that. So we had the mandate. We studied Olive. From there, again, it's built a whole group: Colburn Hill, Boston Software, UiPath, Olive, DataBound. Now there's a whole bunch of vendors that we measure in that robotic process automation space. But again, like Social Determinants, the mandate came from our provider friends that said, go figure out what's going on there, KLAS. And so we did.
Wonderful. Where would you say that field or subfield of vendors is at in terms of sophistication and capabilities?
So this is a pretty developed technology outside of healthcare. Again, companies like Automation Anywhere, UiPath, these are large, multinational. I think some of these are $300, $400, $500 million companies who've really done great in manufacturing and other industries. Now they're applying that technology over to healthcare. But there is that division. These companies, again, UiPath, Automation Anywhere, they've been doing robotic process automation for years in manufacturing. And then there's Olive over here, who's just purpose built for healthcare. And some people love the experience of vendors who know how to do this in other places. Others really like the idea that Olive is just healthcare specific. But Mark, we find 3 ways that you can do robotic process automation within a hospital. And the best analogy I can give is, you can buy a fishing pole. So that's like an Olive, where you buy a tool and you learn how to use it, and you get good at it, and it does some great work for you. Or you can have a group that teaches you how to fish. And that's kind of like a Colburn Hill or some of these others who have a tool, but they also have a huge service layer on top of that, where they really work with the healthcare organization to teach them how to do robotic process automation. And then there's a third group where you can just have somebody do the fishing for you, and you can outsource your robotic process automation entirely to another company who comes in. Not only do they run it, but they tweak it and adjust it. And I think what you have to figure out, if you want to buy a fishing pole learn to fish or just outsource your fishing really is how sophisticated is the provider organization's technical staff. If you don't have good technical staff, maybe you should outsource it. Or maybe you like to tinker a little bit, but you need some coaching. Well, that's that middle section of teach me how to fish. You know, others just really just want the tool and they want to see how far they can go with it. So we find those three flavors, and there's good vendors across all of these areas. Most of the work though today is really in rev cycle and automating claims and claim processing. But everybody we talk to is really optimistic at these provider organizations that they're going to be able to take RPA and move it into other areas of the hospital beyond just revenue cycle. And optimism, I think, is this is as optimistic an area as anything that KLAS measures. People are really excited about where this might go.
Oh, that's great to know. What would your very broad advice be? And obviously, you would love it if providers would subscribe and learn through your reports. But what should CIOs, CTOs, CMIOs, et cetera, how should they be thinking about some of these emerging technologies in the broadest sense?
So there's a lot that is vaporware still, Mark, and that really hasn't changed. And I'm not denigrating any of these emerging tech vendors, but like we have one in particular that claims they have about 14 customers, and we've called all of them and nobody's got the thing implemented yet, right? So there's still a lot of vaporware out there, and you have to be a little bit cautious, you know, get referrals, you know, send a referral over to KLAS, we'll go study something and come back and tell you, but there's still a fair bit of vaporware. The second thing is, and most organizations are like this, but there's a little bit of patience. And I tell the vendors this all the time when we consult with them. If the customer is excited about what you have, but they're demanding more functionality, then they see you as a partner that they can grow with, and that's kind of exciting. But know that none of these solutions are fully baked or have everything end-to-end figured out from day one. They're really good at some things, and so you're going to find, hey, I love these features. I wish it had these other 3 or 4 things. That's very, very normal and expected because they're emerging tech. The third one is, you know, when we measure this, if you're not seeing outcomes within 6 months or a year, that product might not be ready for prime time. And that's really that. And the best window is, and we ask this question, how quickly do you see outcomes? The best performing ones are seeing outcomes within 6 months. Some of them are seeing them immediately. You turn it on and within days, you're actually, you know, seeing tangible outcomes. So that kind of stuff really matters too, is how quickly. And then the last one I mentioned just briefly in the introduction, you really want to check out who the founders are and where did they come from, and do they have a background in tech, and does this kind of make sense? Because again, sometimes you bet on the jockey, not the horse. And a lot of these emerging tech companies, you dig into who their leadership is, and man, they have track records. They've done this before. It isn't their first time around the track. And you know, if they have great track records in the past, other customers are seeing outcomes fairly quickly. Like I said before, it's not too difficult to implement. Those are solutions that really land in that sweet spot. So
yeah, exactly. I think that's right. And that you know, or you at least you can hope they'll be around 5 months from now, right? That's
right, exactly.
That's really important. Finally, how do you see things evolving forward in the next couple of years in this area?
We're just seeing an influx of these requests to study new areas. Like I said, in the last 12 months or so, we published 75 or 80 of these reports. Probably in the next 12 months, we'll probably publish 150 to 200 of these reports.
Wow.
There's a lot of money. Again, I work with our investor team. There is a ton. If I told you it's billions and billions of dollars being invested in healthcare right now, we're seeing an incredible amount of influx of capital, and it's all around areas like artificial intelligence, machine learning, robotic process automation. How do we take some of the mundane bits out of healthcare, and then again, let the people operate at the highest level of their license? Meanwhile, let the computer do some of this. Sometimes it feels like a brave new world. It sounds a little scary, but it's really interesting to see. That's where the money's flowing right now, and we couldn't be more excited about trying to measure this. And again, back to our tagline, you know, separate fact from fiction, separate hype from reality, so we can inform people to make the best possible decisions they can make. So
You're performing a really important service, Doug. I think it's exciting, and I think that the industry needs it.
thank you.
Absolutely. So thank you so much. It's
My
been
pleasure.
great to speak with you today, and continued best wishes. We'll hang on your next word when you next come out with the next report. So thanks again, Doug. You've been a wonderful guest, and we're going to have Matt Rayner return and close us out for the day.
Yes, thank you, Mark, and thank you, Doug, for a fantastic final session to the Mid-Atlantic Virtual Summit. As we conclude today, I want to let you know about what we have in store for tomorrow. Tomorrow is the Mid-Atlantic Cyber Forum. We will kick off the Cybersecurity Forum at 9:30 a.m. Eastern Time with a provider spotlight featuring Penn Medicine. We will also have what will certainly be a fantastic panel discussion on the new reality of securing healthcare. And finally, a featured presentation on cybersecurity readiness measurements. And that will also feature KLAS Research. So we're excited about that. We hope to see you all here tomorrow for that Mid-Atlantic Cybersecurity Forum. With that said, thank you again for joining us here at the Mid-Atlantic Virtual Summit. We look forward to it being in person next year, and we hope you all have a great evening. So thank you very much and take care.
Thank you all.